Good afternoon. I'm Rob Spicker with the school district's communications department, and we want to thank you for joining us for today's Facebook Live. Our focus today is going to be about the reintroduction of peanut butter sandwiches into the school lunch cafeteria menu. Parents, as most of you know, every student in the school district of Lee County qualifies for a free lunch at school, and most of you take advantage of it. Our food and nutrition department works diligently every day to make sure we're serving quality, nutritional meals to your students. You add in the breakfasts, the dinners, the lunches, the snacks we're serving, it's about 87,000 meals per day. No small feat. Food and nutrition works very hard to make sure that everything is safe and good for your children. And over the next 20 minutes or so, we will talk about the reintroduction of peanut butter sandwiches and how it is being done in a safe way to protect those students that have peanut allergies. To get us started, take a look first at this video we've put together about this process of reintroducing peanut butter.
Peanut butter is a great source of protein with heart-healthy unsaturated fat that keeps children full and ready to learn. Starting February 22nd, this delicious snack will be added to the school lunch menus across the school district of Lee County. Safety is always our #1 priority. In an effort to manage food allergies, schools have fully trained staff and will implement protocols to help prevent allergy-related incidents. Schools will ensure that all records are updated to reflect student health status. A peanut allergy list will be shared with cafeteria managers to be uploaded into the point-of-sale system. During meal times, foods containing peanuts will be properly labeled and placed in a special pan so the product is easily identifiable. When students go through the lunch line and input their student ID number, there will be an alert if the student has a registered peanut allergy. The cashier will then proceed to remove the item from the child's plate. On the rare occasion that a student has an allergic reaction despite these protocols, staff is fully trained to identify signs and implement our emergency action plan. Parents can help by ensuring that their child's allergic reactions are listed in their child's health status at the school. Parents can upload the information directly into Focus and speak to their school nurse. We also ask that you speak to your children about food safety and the importance of not sharing food with others. Remember, hand washing with soap and water is a great way to prevent cross-contamination. Together, we can safely reintroduce peanut butter as a delicious option for protein into our schools.
Peanut butter jelly time, peanut butter jelly time, peanut butter jelly in the baseball bat. Hey, hey.
All right, so with that as the basis to begin, our panel today consists of Candy Messenger, who's the Director of Food and Nutrition Services, Amy Carroll, a Coordinator in Food and Nutrition, Wally Colon, the Assistant Director in Health Services, and also Chuck Bradley, who's the Director of Positive Prevention. If you that are watching have questions, you can put those in the comments section, and we'll get to some of those at the end of their presentation. So Candy, I'll turn it over to you to get us started.
Thank you. So welcome and thank you for joining us today. Like Rob said, we're here to talk about peanut butter and other food-related topics. So the reason behind us bringing back the peanut butter and jelly sandwiches into the district is at the beginning of the school year, we were notified by our grocer vendor that they were going to end our contract effective December 31st. Then so we had to find a new distributor, which we did, and that's Cisco from the West Coast Division. They service other districts in the neighboring districts for us. So to make the transition easier, we have modified our menu to work for the products that we have available, and many of the districts in Florida and across the nation have never stopped serving peanut butter. So those are the reasons why. I always have access to a Florida school nutrition survey that did a survey of the districts here in Florida. 77% continue to serve peanut butter, and 62% have a district allergen plan. So we have worked very close with other teammates here in the district to make sure that our students are safe in developing what the protocols that we need to keep them safe. As the video stated, the peanut butter is a great source of protein and is available and cost-effective for us. Food and nutrition, to prepare, we have made bright stickers warning that a product contains peanuts, and those stickers will be on the sandwiches themselves, so there is not a mistake. We've also ordered special pans for the service line. They are the color black. They will be set up on the serving line in the same location at the schools. So there isn't going to be a switch up on the service line, so it's every day that's where the peanut butter sandwiches will be. We've also have signage for the service line, so it's very well indicated that we have peanuts on the menu for that day. And then just other important topics is with the supply disruptions that we are seeing across the nation, menus may vary from school to school. So, because we are utilizing the products that Cisco is able to bring into us to make sure that we're feeding the 87,000 meals a day. So food quality is very important to us, and we are, as we are notified that there are questionable qualities, we are retraining staff. We are going out to the schools to ensure that our students are being fed top quality meals. So if you have concerns, please reach out to the Food and Nutrition Services Department so we can address those and do some retraining with our staff. I'm turning it on over to Wally.
Thank you. One of the things that we've done from a health services standpoint was to create and officially have approved a couple weeks ago was the Allergy Management Policy 4.223, which states goals as a school district to reduce, identify, and recognize any adverse reactions that we could potentially see during having this food distributed. It also states any accommodations that can be available to students with severe allergies and parent responsibilities, among other things. One of the things that we've also done was to work together with our application services department to create an open up focus again to allow parents to provide updated allergy symptoms that they may have or any allergy reactions, in this particular case to peanuts. But it focuses on three main questions, which is if they're allergic to peanuts, if they have any allergies in general, and if they have any medications. With this information, we're going to be using that to give that information to teachers on a need-to-know basis, so that way they are aware of the students that they may have in their classrooms that have any food allergies. It also will allow us to create flags on their focus accounts and also update CDMS, which we're using that as a report to give to our cafe managers so they are able to identify students with food allergies as they're going through the cafe line. And as you can see through the video, it popped up the allergy alert in the cafe line, and then the cafe manager will then give a different meal option to that student that may have a food allergy, because that's what we want to be able to prevent. As parents are providing this information to us through Focus, the nurses are creating emergency action plans. These are plans that we've been working on for quite some time, so it's not something that we created because of this peanut butter rollout, but we've been doing them. So the staff are very familiar with them already. Basically what they are step-by-step directions on what to do in the event of an allergic reaction. So who do they need to notify, which child has a food allergy, and they're very student specific, and if it even says whether they have medications within our school building. As you saw through the education video that we were able to create, many different people came together to create this video that is geared toward the smaller kiddos, just so they can see what they're going to be doing whenever the peanut butter is rolled out. Talks about safety processes that we have in place within our school campuses and the cafeteria, and also parent responsibilities such as not sharing food and talking to them what their food allergies are. So it's really important that parents are talking to their child letting them know you have this food allergy, you have that food allergy, because we want the kids to be advocates for themselves to say, hey, I can't have this food product, because we want to be able to provide that safety measure. And then also we want students to be encouraged to also wash their hands anytime that they do come in contact with this food allergen, because they want to use soap and water to remove that protein off of their hands. School nurses are available to provide general trainings whenever it comes to signs and symptoms with many different health conditions. And again, in this case, we want the teachers, staff, and everybody in general to be aware of signs and symptoms that they need to look for in the event that the child is having an allergic reaction, so that way they know what to do whenever things like that happen. And we want to thank many different people that came together with us to make sure that our peanut butter rollout was as safe as possible. So you can see there was many key players here, and I want to thank this fabulous team that I have up here with me, because we were able to do this together as a team. So we're really excited.
All right, is that the end of the presentation? All right, so you've gotten the idea there about how we've gone ahead and worked very hard to make this very safe for you. We did solicit a number of questions in advance, and we're watching the comments that you're posting as we move forward. So there is a couple of questions that have come in already, and one is just simply asking, these are prepackaged sandwiches, how truly nutritional are they? Are they good?
They're very good, actually. I'm one of the registered dietitians on staff, and what a lot of people don't know is that many commercial items that you see in school have been reformulated by the manufacturer to meet the USDA's nutritional standards. And the Smucker's Uncrustables are one that have been reformulated. The first thing is that they're on whole wheat bread, which is different than what you're going to find at the stores. There's also reduced sugar in comparison to your store Uncrustables, and each Uncrustable provides a full serving of peanut butter, which is actually, like we've talked about, a great source of protein, heart-healthy fats, very important for these growing students. Peanuts are actually considered a superfood with over 30 essential vitamins and nutrients. So they are prepackaged, which, how I look at it, is more of a safety measure, because a lot of people say, are nervous about peanut butter coming back, but we've never had peanut butter sandwiches banned in the cafeteria and lunches brought from home. So these Uncrustables are all individually wrapped, which means there'll be no chance for cross-contamination in the kitchens at all. And they'll be opened in the cafeteria where peanut butter sandwiches have always been anyway.
That was a question that was asked. How is this any different from students that have been bringing peanut butter sandwiches to school from home?
Like I said, there really is no difference, because I think a lot of people are worried about an increased risk of cross-contamination back in the kitchens, and that won't be the case. We're not making peanut butter and sandwiches. We're not doing recipes with peanut butter. We are simply serving the individually wrapped Uncrustables.
There was a question that came in that I saw that was out there about parents whose children do have the allergies, concerned that they can't smell, they can't touch peanut butter without an allergic reaction. So how are they protected if they're that sensitive and staying safe?
And I'll be happy to answer that. So we oversee in the district Section 504, which is an equity law that protects students who have a disability. And so for students who have a severe allergy that can prevent them from fully participating in the educational day, parents have the right to contact the equity coordinator at the school to establish a 504 plan for their student, which would provide accommodations for that student to ensure their safety on campus and alternatives that would support them so that they could still participate in the school day and be safe.
So that would be the step. If your child is that allergic, reach out to that person at the school. Just to clarify, I think some questions about the protocols in place. You need parents to sort of take the first step and get that new file on alert in their Focus account.
Correct. So that is how we are going to gather that information, is by having that open communication with parents. They're going to provide us the information. That information comes straight to the school nurse. The school nurse will then update the clinic data management system, which is a computer system that we use in the clinic. And from there, we're going to go ahead and disseminate the information to the staff members on a need-to-know basis only. Is there going to be a chance that a child has an allergic reaction for the very first time at school? Maybe, but that is why we're going to fall back on district policy, going based on signs and symptoms and alerting emergency services when it is necessary.
For students with allergies or those that may have their first, are there medications? What can, if anything, a school have on hand, or does it have to be provided by the parent? What does that look like?
Right now, we do have medication on campus if it's ordered by the physician. We have parental consent, and the parents are providing that medication from home. So there's many different medications that can be given to the child, but it is through that medication order through the doctor.
I know where we've gotten this from, but we'll get rid of it. Interesting interruption. Candy, you messaged this or mentioned this, but the staff training. Great deal of preparation has gone into making sure that not just the kitchen staff, but also the custodial staff is ready to help clean up. Can you dive a little deeper into some of the steps that have prepared the custodial and kitchen staffs for peanut butter?
We have worked closely with the other departments to ensure that cleaning procedures are being taken care of, washing down the tables, the contact surfaces, frequent contact surfaces are cleaned, and also the kitchen staff is aware of students, and we will be able to clean between the line, between services. And we're working closely with schools to make sure that they have their indicators for these allergen students. So we are prepared, the service line and the cashiers are aware and are able to take care of any allergen that comes up to ensure that the students are safe coming out of our service lines.
Rob, if I could just add to that for 1 minute. We've also met with our principals to talk about this, and so principals will be monitoring the systems on their campus to make sure that these things are happening, and especially if there's substitute staff, they'll be alerting them to follow through and just kind of monitoring that whole process to making sure our campuses are clean.
General question that came in, what kind of inspection requirements are there for the food that's served and the kitchens that they're served out of in our schools?
We have field managers that make frequent trips into the kitchens and to observe meal services, quality of food. We also have a team of inspectors that come out, that's on my team, and then the health department also inspects. So when we receive any concerns from the community regarding quality of food, we immediately take action. We make a visit to the school, we retrain staff, and work with them to ensure that the quality of food is there.
And that was another general question, some concerns about the quality not always being of the standard you might want being served. So the student that gets that meal or sees that meal, the parent that hears about it from their child, what do you want them to do?
Please contact my office and we will take it from there, and we will make, again, visits to the school and retrain staff as necessary.
You want healthy, good lunches
Yes.
served every day.
That is the expectation from my office, yes.
All right. That really wraps up the questions that have been sent in. If there's anything else that you might want to add, well, here's a follow-up. Anything extra for our younger students? Since they're the youngest, kindergarten through third grade, is it just going to be the monitoring on the line, or are they getting a little extra attention?
They will need a little extra attention and reminders that they do not share their food out on the cafeteria. We have worked with our managers to ensure that the allergen list that we get from health services are updated into the system. So this is a priority to keep all of our students safe.
All right. Any last thoughts, comments? Or you think you've wrapped it up? I think you have, because that addresses all the questions that have come in so far. So we appreciate it. To Amy and Candy, Wally, Chuck, thank you for joining us here on this panel and getting this information to our families and to our parents. Hopefully you all understand that every step taken possible is in place to make sure that peanut butter is safely put on the menu starting next week, February 22nd, when students return after their holiday weekend. We appreciate you joining us. Have a good afternoon, and we'll see you again on the District's next Facebook Live.